All right, guys. So I had a patient interaction overnight. I just got done with an overnight shift. I got a patient interaction overnight that really reminded me of a very important aspect of our jobs as emergency medicine physicians. I'm speaking to you guys, but I really hope that young emergency medicine physicians are listening to this. It's not really a sexy video. It's not really going to be about blood, guts, and trauma and chaos of the emergency department. I believe that it's important to highlight this aspect of our job. In medicine, in medical school, in residency, we focus a lot on the clinical aspect of our jobs, but sometimes we neglect, a lot of times actually, we neglect the non-clinical aspect of our jobs, the personal relationships and stuff like that. As part of my job as an ER doctor, I have to call specialists sometimes at 3 a.m., wake them up from their sleep. I have to make sure that the patient gets admitted to the hospital if I believe that this is something that will benefit them. I need to make sure that they get the scan or the MRI or whatever they need. Sometimes it's difficult. I have to discuss these patients, and sometimes I get some pushback. Unfortunately, it's just part of the job. As a result, every ER doctor has to be a great patient advocate. And I'm speaking to you guys, the young ER docs here out there. Make sure that you're a good patient advocate for your patients. You're going to get some pushback sometimes. You have to be able to push against those pushbacks. You have to make sure that you speak up and speak out for your patients. Sometimes this is the only way your patients are going to be able to get the help and the care that they need. Always, guys, make sure that you advocate for them. You really don't want your patient to go home because you weren't able to advocate for them and something happens to them, right? Dr. Kouandjio, your hero. I love you guys.